Now, now this is now see, this is the articulated. Even this picture is also the right side. 1975, in 1975, I had purchased this book, 35 rupees. Now it is, I think, 5,000 or something. If you value gold price, then, but I preserved this book. It is, binding is loose and all. And today, I have the opportunity to share this picture with you. I have, in the wishing rays, I have many books. Even old Cunningham dissectors, but this picture attracts me so much and it becomes so easy. You can just glance, you share the bones, you pass it down to your next friend. Okay. Now you see, this is the Navicular, the three Cuneiforms. This is the Cuboid. This is the your Talus, Navicular, Talus, Calcaneus or Calcaneum. You see this arrangement. This is the thing, you hold it, medial malleolus. I think I have to have big pockets, so oversized জামা হয়েছে না? So anyway, now see, this is the calcaneum. This is the your three navicular cuneiforms, navicular, this is the talus, and this is the fibula, and this is the medial malleolus, this is the lateral malleolus. I showed you there's a pit. You just, I'll give it to you, there's a pit. Like a violin, I told you that you hold it. So that becomes, this is the anatomical position. And the medial malleolus is robust. Okay. These components are such that it has been arranged in such a way that the upper end of tibia and your articulating of the lower end of the femur, and there is some bit, if you see, it is not in one plane straight. It is having, for the knee joints, this thing, your these upper end is, the pits are there, the oval surface, articular synovial joint, and the condyles, lateral and medial condyle. Upper end of the fibula articulates with the shelf of the, it articulates with a small articular surface, oval articular surface. Second thing, in the lower end, which forms the inferior tibiofibular joint. This is the superior tibiofibular joint. And you see the bones, the metatarsal bones and metacarpal bones. Now, you see the metatarsal bones, there are 5 metatarsal bones. Now, the base of the metatarsal bones, base of the 5th metatarsal bones. Now, if you see the base of the metatarsal, 5th metatarsal, this, you can see, I have exaggerated. Now, you have seen the film Romeo and Juliet. Please search, I don't know if you get it. The old Romeo and Juliet. Now, Romeo did not jump from the first floor, but modern Romeo sometimes they have to jump from the first floor. And actually, what happens if you fall from the first floor, you fall like this. You fall like this. Then you run. Okay. Now, at that time, the most prone fracture is the base of the 5th metatarsal and also the calcaneum. This is one thing. Second thing, and these policemen and all these army surgeons, they're standing long hours. Now, they are, limping, comes to your clinic, then you have to order for a radiograph or X-ray, AP lateral view. Okay, then you will see that the base of the 5th metatarsal is cracked. It is fractured. This is the most prone bone that is having a propensity of having fractures. Now, this is one thing I tell you, another thing is that ইয়ে করতো দেখা আর ইয়েটা so please try to এটা কি দেখাচ্ছে now you see this is the anterior portion, this is the mid portion, and this is the posterior end. Posterior end. Anterior mid portion, the anterior portion, mid portion, and the posterior portion. You have to know the anatomy also for your amputation. There are some amputation, that is Syme's amputation in the mid surface, and you could do the amputation, and you have to know it first. Second thing, your এটা কি কেটেছে তোমার বাহ দেখি এটা আর্টিফিশিয়াল না কিন্তু now you can see the altar দেখো now you can see the arch of the now see sometimes the flat foot from birth the child might have flat foot then you have to give some corrective shoes okay you if the mother of the child comes to you and she says দেখুন আমার বাচ্চাটা কিরকম করে হাঁটছে এরকম করে হাঁটছে flat okay now in you see that now see the arch of the foot it is like the spring it's like a spring inert masonry arch it is a spring and you can see variations of metatarsal facets namato nama nama yeah I don't know see yeah the medial axis calcaneum this is lateral aspect this is the ossification centers in see the today is tomorrow will be Saraswati Puja in Bengal there is a practice of drawing alpona okay now previously that is the foot of the goddess Lakshmi or Saraswati and it's a beautiful foot. Now, when I was a kid, I was in class 3. So my uncle was to get married. So my grandfather accompanied me. I accompanied my grandfather to see who will be my aunt. So previously, if chul khule thakto, so she's having a tresses of hair up to this gluteus maximus or more up to the knee joint, and also at a boi dito, a book to read. If there is any stammering, একটা গান করতে বলতো, হ্যাঁ, এগুলো ছিল the tests a woman had to go for marriage. এটা একটা মজা করলাম, কিন্তু এখন তো নিজের যেমন আমি নিজে প্রেম করে বিয়ে করেছি, হ্যাঁ, তারপরে সেটেলড হয়েছে, নো লড়াই। Okay, now I just drew this picture because see, if you take some powder or powder নেই, color you cannot in your clinic আলতা নিয়ে আসতে বলবে, সেটা তো হবে না, কিন্তু you see, open the shoes, and you just open your shoes. If you are a bit suspicious, you see, put her foot in this thing, or you tell her to sit. You sit in a stool and see if there's the arch. Then accordingly, it can be the operative procedures to correct flat foot. There can be some beautiful shoes you have to recommend. Recommend means not from stores, not from Amazon. You have to go to the people who are specializing in these orthopedic shoes. And accordingly, from tender age, you have to, by gradation, that will be corrected. Okay? Now the arches of the foot. Next, ball. Next. Now, how to draw organization, bones of the articulated foot organization, how to draw talus, calcaneus, middle unit, 5 small tarsals and metatarsal arches, ossification. Identify parts in the living foot. Sole of the foot, articulated foot from below, plantar fascia and aponeurosis, cutaneous nerves, plantar muscles, first, second, third and fourth layer, long tendons on skeletal plane, peroneus longus, tibialis posterior at the anterior, lateral plantar artery, plantar arch, lateral plantar nerve, medial plantar artery and nerve, door of foot, rearrangement of tendons, comment on vessels and nerves. Next. Bones and see the previous picture I told you, you have seen that depicted this picture. Now this is a articulated foot. You have already the Santiniketan tali on talar shelf. This is a talar shelf or Santiniketan tali. Now you are knowing already the phalanges, metatarsal, tarsals. Okay. Now functions of arches of foot, proportional distribution of body weight, flexible lever for forward propulsion, protection to plantar vessels and nerves, acts as shock absorbers during jumping and jolting. এই যে আমরা ছোট সব কিছু is not injured. It is in such the skeletal element is in, and the muscles, plantar fascia and all protects the foot. তখন ধরো পায়ের ওপরে the foot is carrying weight, and also you have to walk through uneven surfaces. If you are a trekker, then you have to go and climb, and then suddenly you have to be this thing. It is designed as such that the bony component and the muscles and the tendons, all the tendons on your leg, they go in tibia that and fibula, the tendons go and into the phalanges. Also and the whole cushion like effect. That's why, but one thing is, this interesting thing is that I wear a shirt of 5,000 rupees. I wear a jacket of 5,000 rupees, but I wear a shoes 200 rupees. You are wearing a beautiful suit, you are wearing a beautiful ghagra or something, but if I look into your foot, it is the most uncared area of the body. তুমি এখানে facial করাচ্ছো, ভুরু ঠিক করছো, but foot has to be taken care of because of vulnerability of injury and the stress it goes through, that it can anytime you skid, you can have a sprain, you can have the specific points I told you of having your fractures. Now see, protection of plantar vessels acts as a shock absorber during jumping and jolting. Now arches of the foot: medial longitudinal arch, lateral longitudinal arch and transverse arch. Okay, you can have a long question also. Now you see medial longitudinal arch, the bones: calcaneum, talus, navicular, 3 cuneiform forms, metatarsals. This summit, trochlear, surface of talus. If you see this talus, the trochlear surface. Okay, anterior pillar, head of the metatarsals. Posterior pillar, medial tubercle calcaneum, the tuberosity of the calcaneum. Just science, try to know the science of the arches of the foot. It is like the arches of the bridges. It has the same science as the foot. Now, keystone, head of talus. Now, key joint, tubular cuboid joint, key ligament, spring ligament. More bones and joints, more resilient. Now here, medial longitudinal arch, and you can see the ligaments, different types of this. This is the spring ligament. This is the tibio-spring ligament. This is posterior tubercular ligament. Take your tubercular ligament here. Yeah. Now lateral longitudinal arch, bones, calcaneum, cuboid, metatarsal. Okay, this is the calcaneum, cuboid, metatarsal, 4th and 5th. Summit, superior surface of the calcaneum. Anterior pillar, heads of the metatarsal. Posterior pillar, lateral tubercle of the calcaneum. Yeah, lateral view. Now keystone, calcano-cuboid joint. Calcano-cuboid, this keystone, this is the arch. Okay, longitudinal arch. Keystone, calcano-cuboid joint, key joint, calcano-cuboid joint, key ligament, plantar ligament. The plantar ligament, when you dissect the or you see the prosected body, you will see your plantar ligament. Less bones and joints more rigid. Less bones and joints are more rigid. I mean, so many joints are there, so you can just run like this, or you can dance. You can do a waltz, and you can do just you can ball dance. You just go like this, and you want to Kathak and all this. Kathak has mainly footwork is more. You have seen your Kathak dance, Birju Maharaj. Birju Maharaj, you have not seen. You need not see. I'm telling by your age. I'm not saying, but you can see in YouTube. Okay, go home, see walls, see YouTube from Birju Maharaj footwork. He's see you are running. Okay, now a sprinter, 100, but footwork he in such a way he's like a duck. He moves his footwork as such as like a duck. Again, he wants to do a high speed, then he goes in high speed. Just giving you just a name because we are to see the movements. Now you can see the lateral. See these are the supports. Transverse arch of the foot. Each foot presents a half arch. Each foot presents a half arch. Complete arch is formed when both feet are approximate. And when you're approximated, it's a complete arch. But if you walk like this, then you are, and both feet are approximate. Each foot presents a half arch. Complete arch is formed when both feet are approximated. Bones, cuboid, cuneiform, basis of metatarsal. Pillars, basis of fifth metatarsal. See, transverse arch of the foot. Pune components of your CCC, NTC. CCC, NTC. It will give you, that is the main key of your, see, this is I told you, maintenance of arch. How the arch is maintained. Hey, Babu, একটু দাঁড়াও, একটু দেখ, এটা দেখ, এটা দেখে নে, হ্যাঁ, ছবি তুলতে চাও, ছবি তুলে নাও, মোবাইলে তুলে নাও। দাঁড়িয়ে তোলো, বসে না হয় তাহলে দাঁড়িয়ে তোলো। হয়েছে? Now see, now this is the keystone, and see the shape of the stone. This is the keystone and shape of bones and shape of stones of the bridge. Okay, intersegmental ties. Now you see these intersegmental ties. These are the now tie beam. This is the tie beam here. See. And this is the suspension here, tendon, peroneus longus. Maintenance of medial longitudinal arch, shape of bones wedge shaped, intersegmental tie, spring ligament, tie beams, plantar aponeurosis, flexor digitorum longus, flexor digitorum brevis, flexor hallucis longus, flexor hallucis brevis, abductor hallucis. All flexors, plantar aponeurosis. You please, in the next week, see the bodies, that is, foot is there. देखने में एक बार. Now, tri-beams, plantar aponeurosis, flexor digitorum longus, flexor digitorum brevis, flexor hallucis longus, flexor hallucis brevis, abductor hallucis, suspension, tibialis anterior and posterior. Now, how it is suspending? Now, it is the tibialis anterior and posterior. That is the suspension. Maintenance of medial longitudinal arch, shape of the wedge bone, wedge shaped, shape of bones and intersegmental tie, spring ligament, tie beams, plantar aponeurosis, flexor digitorum longus, flexor digitorum brevis, flexor hallucis longus, flexor hallucis brevis, abductor hallucis. All the components of these tendons are pulling it. That's the spring ligament. It will be a short note. And suspension is tibialis anterior and posterior. See, yeah, you can see the picture, tibialis posterior. Yeah, this is the tibialis anterior here. Now this is flexor digitorum longus. This longus goes to the digits. Flexor hallucis longus. This is the hallux. This. Now maintenance of lateral longitudinal arch, shape of bones, wedge shaped intersegmental ties, long and short plantar ligaments, tie beams, plantar aponeurosis, adductor digitorum, flexor digitorum brevis, flexor digitorum longus, flexor digitorum brevis, suspension peroneus brevis and tarsus. When you see the foot in the your diagram plus your dissected body, you can see you can open your foot and you can just see even these ligaments and this thing are visible. Yeah. Maintains the arch of transverse, shape of bones wedge shaped, intersegmental ties, deep transverse ligament, tie beams, tendon of peroneus longus and tibialis posterior, suspension, peroneus tarsus, peroneum brevis on lateral side and tibialis anterior and tibialis posterior on the medial side. I showed you the previous slide where tibialis anterior is going, tibialis posterior is going. Now, and peroneus tarsus and peroneus brevis, these two components muscles come like this. Yeah. See, tibialis posterior. Maintains the arch of transverse arch. Now, clinical anatomy, flat foot. See, flat foot, pes planus, and part of the normal foot. Now, metatarsalgia, pain in metatarsal region of the foot, radiating towards the toes. Thank you. ঠিক আছে? Now, bony component দেখে নাও একবার করে. You please view, photograph that picture. You will find nowhere. And that is as far as my knowledge goes. But even if you find it, you see it. You copy and paste in your brain. Okay? ঠিক আছে?